How your blood group type can influence your health. Dr. Karl Landsteiner was awarded the Nobel Prize in 1930 for his development of the ABO blood group system, a method used to classify blood types. Having knowledge about your blood type is crucial when donating or receiving blood, as a mismatch can lead to immune system reactions resulting in various complications, including kidney failure, blood clotting, and, in severe cases, even death. There are 8 main blood type. 1 type A positive, 2 type A negative, 3 type B positive, 4 type B negative, 5 type O positive, 6 type O negative, 7 type AB positive, 8 type AB negative. Knowing your blood type help you better understand your health risks. What determines if your blood is positive or negative is the rhesus (Rh) factor, which is an inherited protein in red blood cells. If your blood cells have the Rh protein, then you have a positive blood type. If there is no Rh protein in your blood cells, you have a negative blood type. Dr. Ramsey explains how your blood type may affect your health. Heart disease. Of the 8 main blood types, people with type O have the lowest risk for heart attacks and blood clots in the legs and lungs. This may be because people with other blood types have higher levels of certain clotting factors, which are proteins that cause blood to coagulate, solidify. A heart-healthy lifestyle is particularly important for people with type A, B and AB blood. Cancer. Studies have found that people with type A or type AB are at higher risk for gastric cancer. Additionally, if you have type A, type B or type AB blood, you may have a higher risk for pancreatic cancer. Knowing your blood type is one more way to better understand and manage your health. While your blood type is genetic and cannot be altered, making healthy choices can help you reduce risks to your health. What does your blood type mean for your health? How blood type is determined. Blood type, similar to eye color, is inherited from parents and is determined by the presence or absence of specific antigens. These antigens, if unfamiliar to the body, can potentially elicit an immune reaction. ABO and the most prevalent blood types. The ABO blood group system categorizes blood types based on the variety of antigens found in red blood cells and antibodies in the plasma. Together with the Rhd antigen status, these factors determine compatibility for a transfusion, ensuring safety. Group A. The exterior of red blood cells has A antigen, while the plasma carries anti-B antibody. This antibody targets blood cells with B antigen. Group B. Red blood cells surface holds B antigen, while plasma contains anti-A antibodies. These antibodies target blood cells with A antigen. Group AB. Individuals with type AB blood have red blood cells that possess both A and B antigens. Conversely, the plasma of type AB does not contain antibodies against either antigen. Hence, those with type AB blood can safely receive AB-O blood types of any kind. Group O. For the O blood type, the plasma has both antibodies against A and B, while the red blood cells lack A or B antigens on their surface. This blood type is compatible with any AB-O blood type. Rhesus factor. Certain red blood cells have a protein called the Rh factor or antigen. When red blood cells possess this Rh antigen, they are categorized as Rh positive. Conversely, if they lack this antigen, they are categorized as Rh negative. Blood type testing. A blood test can be used to determine an individual's blood type. In a laboratory setting, the blood is combined with 3 substances to observe their reactions. These substances include antibodies for A or B, as well as the Rh factor. By analyzing these reactions, the technician can accurately identify a person's blood type. Heart disease. Research indicates that individuals with O blood types have a reduced risk of developing coronary heart disease. The exact reason behind this phenomenon remains unclear to experts. However, it is suggested that other blood types may have elevated cholesterol levels and increased amounts of a clotting-related protein, potentially explaining the discrepancy. Memory. According to a limited study, individuals with blood type AB have a higher propensity to experience cognitive and memory issues, potentially increasing their risk of developing dementia, in comparison to individuals with different blood types. Lifespan. Chances are higher you'll live longer if you have type O blood. Experts believe this is mainly due to a lowered risk of disease in the heart and blood vessels. Stomach cancer. People with blood types A, AB, and B are at higher risk compared to type OS, especially individuals with type A blood. This correlation is believed to be due to H. pylori, an infection more prevalent in type A blood. This infection is typically detected in the stomach and can lead to inflammation and ulcers. Stress. Type A blood individuals typically have higher levels of cortisol, commonly referred to as the stress hormone. Consequently, this hormonal response can pose challenges for them when coping with stress. Pancreatic cancer. People with blood types A, B, or AB face an increased risk. The molecules found in their red blood cells facilitate the growth of H. pylori bacteria in the gut, which may heighten the likelihood of developing pancreatic cancer. Malaria. Malaria may be contracted through mosquito bites. However, individuals with blood type O have a lower risk as the parasite encounters difficulties in adhering to their cells. Ulcers. Peptic ulcers are open sores that can be quite painful and appear in the lining of the stomach or upper intestine. It appears that they are more common in individuals with blood type O. Diabetes. More research is required to comprehend the reason behind the higher prevalence of type 2 diabetes in individuals with blood types A and B. Fertility. In a recent study, females with a low count of fertile eggs displayed a higher tendency of having blood type O compared to other types. Nevertheless, further investigation is required to comprehend the underlying reasons. Rheumatic disease. Rheumatic disease is a collection of over 200 ailments that result in joint, tissue, tendon, and cartilage pain. A study conducted in Turkey in 2017 revealed that some of these conditions were more prevalent among individuals with blood types A and O. Blood clots. Research indicates that individuals with blood types A, B, or AB have an increased susceptibility to developing venous thromboembolism, VTE, which occurs when blood forms clots within deep veins. Stroke. Individuals with blood type AB are at a higher risk of stroke, as it is believed they have a greater tendency to clot compared to other blood types, as per medical experts. Lupus. Lupus is a medical condition where the body's immune system causes pain and inflammation. Research has indicated that individuals with blood types A and B experience more intense symptoms compared to other blood types. Multiple sclerosis, MS. Multiple sclerosis, MS, is a medical condition where the immune system targets myelin, a protective coating around the nerves. It is a chronic condition with the potential to cause significant disability. Studies indicate that individuals with blood types A and B have an increased susceptibility to developing MS. Inflammatory bowel disease, IBD. There are two primary forms of IBD, ulcerative colitis and Crohn's disease. Research conducted in Italy and South Korea revealed that individuals with blood type O had a reduced likelihood of developing Crohn's disease. Hemorrhage. Severe trauma, the kind sustained in car accidents or other injuries, often leads to significant blood loss. Research has shown that individuals with blood type O are more prone to fatal hemorrhages. However, further investigation is required to fully comprehend the underlying reasons behind this phenomenon. Risks in pregnancy. During pregnancy, the Rh antigen becomes relevant when a mother with Rh negative blood is carrying a fetus with Rh positive blood. Antibodies from the Rh negative mother can potentially harm the red blood cells of her Rh positive unborn infant by entering their bloodstream. Scientists have yet to grasp the connection between blood type and specific illnesses, leaving the relationship between the two largely mysterious. Currently, it is believed that a mixture of genetic predisposition and environmental influences contribute to the onset of numerous diseases. In order to gain a comprehensive understanding of this association, additional research is necessary. Please subscribe to my YouTube channel SDK Online Stroke Awareness.